So mother has come for religious circumcision, and she had some concerns regarding the procedure, and you have to address the concern and take the consent also.
Okay.
So it is
Okay.
like any other consent, even like similar to bone marrow consent, like they will
Yeah,
explain the
yeah. Yes. Yes.
procedure in side effects, and then just give support and
Yes.
options, alternatives.
Yeah. Yeah.
Okay, you
Okay.
say I'll start time.
Yeah, I'm ready.
So mother's name is Hannah,
Mm-hmm.
child's name is Jack.
Child name is
Jack.
Jack. Okay. Hello, good morning.
Good morning.
I am Dr. Hiren, one of the children doctor here. I believe I am talking to Hana, mother of Jack.
Yes, I am.
Nice to meet you, Miss Hana. Thanks for coming today.
Thank you,
Uh,
doctor. Same here.
you are most welcome. So, Miss Hana, today I am here to discuss with you regarding the surgery plan, procedure plan for Jack and taking consent for that. So, would you like someone else to attend with you?
No, doctor. His father is away, so you can talk to me.
Okay. So, Miss Hana, today uh, I will take consent regarding the procedure called circumcision. What are your updates regarding this procedure? What have been told to you so far?
Yeah, doctor, before signing consent, I have lots of queries. So up till now, I have been told that this is a regular procedure, and maybe same day we can go home, and not a very serious procedure. But I want
Yeah.
to know more about it, doctor.
Yes. I appreciate your knowledge, Ms. Hanan. As you said correctly, it is a kind of a simple kind of a procedure, and usually discharge also is on the same day. But let me go through a little bit more detail about this procedure. And any point of time, if I'm not clear, you can stop me so I can go through the same point again till it becomes clear.
Yes,
So
doctor.
the surgeon will also explain to you about this procedure in further, but
Yes, doctor.
yeah, this procedure, first of all, the some four part of the skin they remove in this procedure, and also this procedure needs uh, babies like Jack needs to sleep, and the anesthetist doctor they will give some sleep medicine and also some medicine for the pain. So Jack will not have a pain, and also he will sleep during the procedure. Am I clear so far? Are you with me, Miss Hannah?
Yes, doctor. But you said that Jack will sleep. I'm a little bit scared. Like he may have some problem with the sleep medication. He's very small.
Yes, I can understand your worry, Miss Hanan. Before they do procedure, generally they advise you to not to give milk for a few hours before the procedure, as well as these doctors and the teams are very well expert in this procedure, and generally the chances of complication are very less in this procedure. Are you
Okay.
with me?
Yes, doctor. So can you tell me how long it will take for the procedure, doctor?
Yeah, this is a very good question, Ms. Hanan. Generally, it takes a half an hour to 1 hour, and the surgeon also will explain to you about this procedure and steps in detail. And even the specialty nurse also will guide you through this procedure, and anesthetist doctor also, those who makes baby sleep also will talk to you about this before they start, and you will
Okay.
be thoroughly guided, guidance will be given to you, and even after the procedure finish the whole team will communicate with you regarding the post-procedural plan.
Okay, okay, doctor. So after how many hours I can give milk to the baby?
Yes, I can understand you are a very keen mother, and this is a very valid question. Uh, Generally, once Jack becomes fully active, and after that, the surgeons we will give you the written plan. We'll start probably uh, first clear liquid and then the milk also after a couple of hours once the jack becomes fully active. But that instruction will be given to you by the surgeon once the procedure done.
Okay, okay, doctor. Then any other side effect like most of the procedure have bleeding as
Yes,
the
Miss
bleeding
Han.
doctor. So
Yes,
how
Miss.
about this?
Yeah, I was coming to that point only, Miss Hanan. There are a couple of the side effect of this procedure. Actually, it is done by the well expert team, but still, each and every procedure has some limitation and some side effects and complication. For here also, like there is a possible complication of little bit bleeding after the surgery, as well as some chances of infection. However, it is very less because it is done in a full aseptic environment, but still chances are there. And also possibly like there might be some swelling after the procedure, but you will be given full instruction once the procedure is done, and also will monitor very closely once after the procedure also, as well as will ask for review and follow up also.
6 minutes.
So, Miss Hanan,
So
uh,
doctor,
yeah, if you have no further question, I
yes,
will.
doctor, I have one more concern, doctor. So will Jack have any problem for passing the pee after the procedure?
Yes, this is very good question, Miss Hanan. Usually, the discharge will be given once the jack pass urine, and there can be chances like it is very minimal, but it can be like because of the pain and after this procedure, the chances are there like he may have difficulty in pee, but that we will look for it, and the chances of that is very less, and we'll make sure before we give discharge jack pass the urine.
Okay. Okay, doctor.
So, Miss Hanan, I think I gave you a lot of information today. So, if you have no further concern, I would like to go through the points which we discussed. If you agree for that.
Yes, yes, doctor.
Yes, Ms. Hanan, thank you. So we discussed today about the procedure called circumcision and about the possible complication of this, and the need for the procedure and the steps for the procedure, as well as about the review and follow up. Uh, I need to like once you agree with that, Ms. Hanan, I would like you to sign the consent so the team can proceed for that. And at the last, I would like to give very important information. After giving discharge from here, we will give the prescription for pain like paracetamol drops, as well as some ointment which you need to apply. And also, I will give you leaflet about this procedure, and uh, I will give you contact number if in any point of time if there is any bleeding or any difficulty in urination or any swelling or fever, please contact to hospital.
Yes, doctor. Thank you, doctor. But my husband will,
But
yeah, in an hour, then we will discuss and we will sign the consent. Is that okay,
but
doctor?
doctor, why you want to do this procedure?
Yeah, she has come for religious actually.
Religious.
It's mentioned in somewhere.
Yes, it is not an urgency. You can talk to your husband, and once you have talked, uh, We'll again meet with you, and you can give the consent during that also.
Yes, time finished. Thank you.
You are welcome. Thank you. Thank you for your time, Miss Hannah.
Yes, Dr. Hiren. Introduction, rapport, then agenda, that everything finished in 1 minute. That's good. Yeah, lots of improvement. Very good.
Thank you.
Then after the body, during the body, you said I will take the consent today for the circumcision. You have not explained anything. Then still you said I will take your consent.
No,
Like
I just actually declared the agenda, like some of the
you had already declared that I will explain the procedure and we may require your consent after that. So that was the
Okay.
repetition.
Mm-hmm.
Then like information today it was little bit better, like regarding long sentences, but still that breaking down of information is required. Like in between you have to take pauses. The summary, you only were talking for almost 90 seconds, you were talking in the end. Like once you started this summarizing, then you immediately explain the leaflets and repeat meetings, everything. There you should take some pauses there.
Okay.
Like summary stop, then okay, is that okay? Then you say about leaflet, then stop, then again say like if you have any question you can ask me. You can break down there also, summary also. After summary, leaflets, and then stop, like concluding remark. Information was good, everything. And this jargon, like surgeon you used anesthetic, but I don't know whether they are considered jargon or no.
What we should use for anesthetic?
Like I don't know, they, it's a common say actually. Some people say it's not a jargon, some people say anesthetic is a common word used in UK, but if you are attending India, then maybe they will consider jargon, I don't know.
I was searching for
what are
what to
the
use for that.
Sleep doctor, why don't you use the sleep doctor?
It came to my
what are
mind.
the indications?
I thought it is not correct, sleep doctor, so I did not use. It
Looks
came
like
to
very
my
odd, na? Sleep doctor
You
or
can use
sleeping
simple.
doctor.
You can simply use anesthesia doctor, which will your baby will be sleep, will
Now,
give the
either you
medicine.
explain, yes, both can be
You
possible. Either you explain the
Like
anesthetist role, what is the role of
we can in any procedure we can say like your baby will be put to the sleep by a doctor, which is called as anesthetic. Then we can
Actually, I
use
was
yes.
anesthetic.
suspecting that this you will catch that this is a jargon, but I was also like searching whether any
But
better.
why you use the sleep medicine and the pain medicine together? They will not give, because if baby is sleeping, why you will give for the pain?
The pain medicine is after the procedure.
Yes,
Uh-huh.
after the procedure, when child will come from the sleep, come out from the anesthesia.
What are the indications for the? What are
Circumcision,
the yes, indication for the circumcision?
phimosis,
Relative and
balanitis,
absolute.
Medical
phimosis,
reasons and
balanitis.
religious, no?
Yeah.
In the
Some
neonatal
medical
One
reasons
procedure,
is
are there,
religious.
and some religious and cultural
One is
reasons.
religious and this religious and cultural, and one is medical. So
Yeah.
medicine in the phimosis,
Balanitis,
balanitis, and
paraphimosis.
these paraphimosis, these are relative indications.
Yes.
But
yeah,
the absolute indication is
Absolute is phimosis.
absolute is zero balanitis, zero tika. What is that perfect
Balanitis
name?
xerotica. Yes.
Yes, that is absolute. What are the contraindications?
only one.
Yes, only one.
Hypospadias.
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 Hypospadiasis. Yes, only.
Yeah.
It's just hidden. They just give this like you're much better than before regarding the long sentences, but still needs to break down the information. Keep a
Yes.
watch
Yes.
in front of you, not more than 30 seconds. Take a pause. Otherwise, your tone, sympathy, empathy is very good. No like question regarding
But this long
When to
sentence is
contact
a
the doctor?
problem.
Have you explained when to contact the doctor?
Yes. Yes. At the last, I gave a reflex. last I mentioned, like if there's a blood in the wheat, if there is any swelling, difficulty in urine,
But
then
blood, how much? Because normally they had some oozing, right?
yes, they say actually it takes 4 to 6 weeks to heal, but at least for up to 4 to 5 days, there might be some oozing will be there.
So how would you explain to the mother that how much blood is there? So
There
you
is,
should report to the doctor.
yeah, there is not mentioned in the leaflet like any specific amount, but they said if there is a bleeding,
Nothing. Yes, everything is not mentioned. You have to.
It is
Because if you
normal.
will say mother, if there is bleeding, definitely in every diaper she will change, or every time he passes urine, there is some blood. Definitely, so she will say that I have to go to the doctor because doctor said is there any blood, she should go.
I
is there anywhere
just
given bleeding how much?
It's not given. It's roughly saying that more than 2 tablespoons.
No, no, 2 tablespoon is in the rectal biopsy and all, not here.
Here
No,
also
no,
you can say that.
roughly they are
Uh,
saying, but they have
not
not given anywhere. They have not given anywhere
For
because
circumcision,
because
too much.
in in the circumcision they are applying this dressing and dressing that is soaked dressing actually.
Yes,
So
yes,
they will absorb, yeah, they will absorb its bleeding. So there
correct.
will be not a big issue because
Yes.
I have worked in surgery also. I have done circumcision myself also.
Uh-huh.
So the
So,
bleeding is not there after circum. Because
yeah,
many children they
very
come, they
very
have
minimum, very
mild
minimum.
bleeding.
Mild, Dr. Bakar, it's usually soaked in the dressing. If the
Uh,
even if the newborn baby, I was doing in newborn actually. If the newborn babies, we are never ever say that you should come back or you should remove the dressing. Dressing will be removed automatically after
itself,
two
yes.
days
So dressing there
itself.
is a ring, right?
Yes, this
Uh,
currently it's a well
yeah,
plastering.
they
Do
are
you apply
wearing the
plastic
ring.
ring there?
Yes.
Okay,
Yes.
so how many days if it will not remove, they should come back?
1 week.
Usually they are saying that usually it's removed, but we were saying that if after 3 days it's not removed, come back.
Three
We were
days,
saying
really?
three 3 days. It's usually
No,
removed second day
I
only.
no, it takes more,
no,
Dr.
no. It will
Rohel.
take 2 weeks until 2 weeks even. Yani, it's
Up to
not removed.
one
They
week,
should
I
report
No,
back.
have
you
many,
you are
many
saying about
I have
the
seen
dressing or what?
no,
ring,
no. Dressing will go after one P or second P.
plastic ring.
Ring,
It's called
plastic ring.
bell
Ah,
plastic.
plastic ring. No. I was not doing that one. This is new one. We are using this only like bell method.
This old
I
man. No,
was,
no, no.
yeah,
We will
old
not
one,
follow
bell
your.
method.
We will not follow your instructions.
No. I was doing this bell method.
Because I think it up to until 2 weeks. If ring has not removed, then their surgeon is removing it. I think so. I'm not sure actually.
Yeah, 1 week it stays. The ring usually stays up to 5 days, 6 days, 1 week like this. But I spoke to regarding this to our
Mhm.
urologist, and he
Mhm.
said better you say all the babies to like it can take up to 1 to 2 weeks. That's what
Mhm.
the instruction was given to me when I asked about this. But 1 week,
Just 1 to 2 weeks, right?
yes.
Usually it removed by 1 week, but if 1 week not, then they should report back.
If it is a medical student in this scenario, if they ask, do we need to do coagulation profile? What will be answer?
No, if there is a family history of a bleeding disorder,
Yes. No, it
then
is
we must
not
do.
required. It is not required routinely, but if there is a family history, only we need to do. Otherwise, no. Yes.
Mm.
Yes.
do we give antibiotic post procedure?
No.
It is
In our
general.
countries
No.
must give. In our countries must give, but they don't give.
What is
They
routine
are
post
not
procedure?
giving. They are giving only paracetamol or brufen only.
They are
Okay.
Yeah.
giving some ointment as well to heal
Yes.
the
Yes.
wound.
Yeah, ointment to apply and these
Mm.
things only.
But still, in many hospitals, they are doing in the local, right?
No.
Yes,
Inhalation.
for For young babies like neonatal, we are applying only the local.
Local, no? Yes, I remember my
Yes.
son, he was around 17 days in Aga Khan, Karachi. I did. They give local only, not in general anesthesia. In Aga Khan, you know, they follow the all protocols.
It's a very bad procedure, really.
Newborn, I think, well, if big child where there is a possibility of crying and all those things, pain, I think
Yes, if it is, they don't do.
yes,
If child is past, I think 1 month or 3 months,
yeah, then they will do GA.
they don't do, I think, for 3 years. They will do after 2 or 3 years of later. I think so. There is some protocol like this. Either first 3 months, if not, then they will do later on when child will be
No,
old enough.
in ours, I don't know in UK. In our countries, even if the child is 4 years, 3 years, they are just applying local, and they are doing. I have seen so many times in the surgery.
Mhm.
They are
He will
not
jump,
giving the risk of
he will cry like
this one.
anything.
No, usually not crying too much, maybe.
UK people are more concerned regarding comfort and pain. Actually, in our countries,
Actually, after the surgery, they are crying more. During the surgery, they are not crying more. I have
yes,
After
seen
surgery,
so
when they
many times
pass the
after
urine,
surgery. Yeah, when they pass urine or they have
Mhm.
contractions of skin, so it causes more
Mhm.
pain. Or when you are removing this dressing, because in the old babies you will have to remove the dressing. So when you are removing the dressing, that's also very painful. Even they start hitting you.
yes.
But you know, there is a good relief when someone applying is warm water. We are
Uh-huh.
advising to apply the warm water with the cotton, to
Simple
put
water,
warm
simple
water
water.
above warm
I
water.
was doing But I was doing simple normal saline. It's available in the hospital. So I am applying just this normal saline, soak for 1 hour, then easily remove. No problem. Easily.
No, no, not removing, just for the pain. When baby pass the pee, then apply the warm water above. Even though if baby is passing the pee in the bathtub, that is much even easier.
Maybe I don't know this one.
Yeah.
Okay. So next scenario is fussy eater. So anybody like Royal, Adna, Vakar, candidate.
Yes, I can be no problem. But I even this is all new scenario. I don't know from where you get these new scenarios.
No, no, facilitator there
It
in
is there in
Mark,
the
Montasir
Mark,
also
Mark.
it is
There
there.
is Mark BT? No, not in
Yes,
Mark BT.
in the Mark BT. In the Mark BT there, facilitator, I think.
Yes, yes.
yeah. This is in
Don't know.
Montasir.
Khidir book is there. That means it's somewhere in the Mark or Rebecca.
Hmm. Rebecca, because I have gone through almost all, but I have
It's
not
in
seen.
Khidir. I don't know Rebecca.
After Montasir book it is there.
Okay.
Maybe one to this.
So Iren, you will be role player, Dr. Adnan, role player.
I can be no issue.
So candidate, you'll be Sandeep. That's better because I even don't know
Maybe
really.
no
I
problem.
didn't go
First,
well.
Sorry?
it's counseling like we do in the OPD. First eater.
Yes, Dr. Bakar, what did you say?
Because I have not read this one, but if Dr. Sandeep will be the candidate, it would be better.
Okay, we'll ask
I
Adnan
can be
again.
role player.
And then you, yeah, it's up to you, whatever you like, role player or candidate.
So Hiren, you will be candidate. Okay.
Yes, it's fine. Yes.
So
Okay.
Vakar, you be role player. I'll keep the
Okay,
time.
inshallah.
So how much time remaining? Can you, can
I
anybody?
think we can finish the scenario, but discussion will take time. So we can restart meeting. That's fine.
Better. So it will be full scenario. Okay.
So 3 years old child.
We will say later one new meeting in the new
I
meeting.
will just end this and we will rejoin. Huh? So it will be full
Okay.
with discussion.